Welcome, everybody. My name is David Martinez. I am a director at Vitalyst Health Foundation. Thank you so much for joining for our monthly Vitalyst 101 series, Spark Partnership, a Vitalyst Introduction. An easy way for you to learn more about Vitalyst Health Foundation if you haven't heard of us, or even if you have to find ways for alignment for our grant partnership opportunities and our broader priority areas as well. On the call today, I am joined by my colleague Michelle Goodthunder, who will be managing the chat room. So if you have any questions as we're going through this session, feel free to put them in the chat room and she'll address them as she can. But we will be opening it up for a live Q&A once I run through the slide deck. If you have any accessibility needs, including Spanish, closed captioning, those services are available for Spanish. Email conversemos@vitalysthealth.org and use the Zoom settings for closed captioning. All the lines are muted, and we'll ask yourselves to stay muted while I'm reviewing the slide deck. But as I mentioned, we'll have a live Q&A session after I review those so we can be in community and dialogue with each other. This video is being recorded. The slide deck, that recording, and other materials that we'll review today will be shared with all registrants for this webinar and will be posted to our Partnering with Vitalyst webpage at vitalysthealth.org. Vitalyst Health Foundation is a Phoenix-based and Arizona-serving foundation. Our vision is that all individuals and communities in Arizona are healthy and resilient. And to do so, we are on a mission to connect, support, and inform efforts that improve the health of individuals and communities in Arizona. That triad of connect, support, and inform, you'll see kind of threes come as we review our priorities, our grant partnership opportunities, and whatnot. But this begins to help frame how Vitalyst does our work. We are a really big connector on some of the greatest health disparities and health priorities in the state of Arizona. We are a grant-making foundation, so we do provide support, though a lot of our support does go beyond just a check or a grant. And we are a foundation that follows a traditional public health method in looking at upstream roles and interventions to improve health and tackle the greatest health disparities and the root causes of those health disparities in Arizona, rather than a more downstream intervention, which is more programmatic and direct service. So when you're working upstream, you work a lot around policy and advocacy. So we do a lot to inform decision makers, especially. While we are a health foundation, we see health as more than just healthcare, though healthcare is very important to a person's ability to live a healthy and healthy life. This is our Elements of a Healthy Community wheel, or the wheel, as we affectionately call it. You may have seen it around the state. This is basically our iteration of the social determinants or social indicators of health. As I mentioned, we are a health foundation, but we see health as more than just health care. We look at all of these elements that make up a healthy community and a person's ability to live healthy. So as you're thinking, is my organization or is my effort aligned, mission aligned with Vitalyst? This is a visual that we use and the elements of a healthy community to begin to help folks better understand if there is alignment. As you can tell, it's pretty broad focus we have. Pretty broad focus might be a bit of an oxymoron. But we partner with a wide variety of collaboratives and organizations across the state that fall within this wheel. You may not see your specific effort or organization, mission, or programmatic areas reflected in these elements themselves, but more likely than not, it is just tucked into one of those aspects. So certainly you see access to care there. While health is more than just health care, quality, affordable, accessible, healthcare is a big priority for us and important to living a healthy life. But you see other things in there like community design, how our cities and towns are developed and planned so that it supports multimodal transportation opportunities, walkability, bikeability, open parks and whatnot. and other elements as well. A big focus of ours is the intersectionality of all of these. It really does take all of these elements, though you may be focused on one particular element. Our work is really in the intersectionality of these things, especially holding that equity and resiliency lens that you see in the core of this wheel. We do hold an equity lens in all of the work that we do here at Vitalyst. And that's reflected in a lot of different ways that I'll describe as we go on with the slide deck. But in general, we really do try to work with organizations that have some aspect or have an aspect of the elements of a healthy community. And as part of that, hold the equity lens themselves by working with those specific populations or communities touched by that elemental disparity and try to tackle that root cause. As I mentioned, we have kind of three aspects of our work: connect, support, and inform. As reflected in our goals, this is turned into how Vitalyst supports collaborative networks, work to strengthen community partners, and as I mentioned, informing decision makers. So this is really important because as I mentioned, we work in an upstream fashion, trying to tackle the greatest health disparities and the root causes of those health disparities through policy, systems, and environmental change. That's hard work and takes a lot of time. It takes a village. So that's why we have a specific goal area to support collaborative networks. At the same time, we recognize that those collaborative networks are made up of individual organizations that themselves need to be strengthened as well. So we have a goal area to strengthen community partners, especially so that they're equipped to advance health equity, as I noted. And then finally, we want those collaborative networks and those community partners to run alongside us and oftentimes lead us by informing decision makers. This does involve some advocacy and public policy work that is reflected in many aspects of our priority areas as well as our grant partnership opportunities. So these three goals are reflected in each of our three programmatic priorities. So Vitalyst, I like to say, has three sides of our house, again with the threes. On one side of our house is our fiscal sponsorship program called the Technical Assistance Partnership of Arizona, or TAP-AZ, where organizations come under our 501(c)(3) status and/or receive back office finance and accounting support. That is one side of our house. If you're interested in learning more about TAP-AZ, visit tapaz.org. On that website, you'll also see their own TAP-AZ 101, a monthly webinar just like this one, but where they take a deeper dive on what fiscal sponsorship is, what TAP-AZ is, and all the services that they provide. So if you're interested in learning more about TAP-AZ, go to tapaz.org for that information. Our other side of the house is a responsive grant making program that I'll review in just a little bit. We are a foundation. We do support entities through grants, and that is one side of the house that I'll take a deeper dive in just a little bit. And on the other side of our house, the third side, we have these programmatic priorities where there may be non-competitive programmatic grant opportunities based on the strategies that each of the directors that oversee each of these priorities outline for our fiscal year with community partners. Each of those activities fall within the three goals that we just reviewed. So these three programmatic priorities are each directed by a different director here at Vitalyst. They include civic health, healthcare integration, and housing. So in the priority around civic health, that is a portfolio that I oversee in addition to our grants program. And it really is about how communities come together every day to tackle their toughest challenges and work to, since we are a health foundation, work to improve the health of their communities. As I mentioned, that we see health as more than just healthcare, so any aspect of that wheel. It really is focused on the what I call the rules of the game that are set and that set systems that either allow or oftentimes inhibit an Arizonan's ability to engage in community and with their government to improve the health of that community. That systemic work is focused on the census, redistricting, and voting policies. And it's the way that we do that is by supporting collaborative networks. Remember that goal number one. In this instance, we support a strong coalition of grassroots community-based organizations called One Arizona, as well as another coalition called the Arizona Civic Life Partnership that is setting civic health progress meters so that we could track our data and progress towards strengthening civic health here in Arizona. We also support and strengthen community partners, goal number two, through an entity called Instituto, which is a capacity building organization for our civic health partners and movement leaders in this space. And we do a lot around informing decision makers and advocacy and public policy around civic health, especially as it connects to voting policies. We're seeing and tracking a lot of bills that would impact an Arizonan's ability to register and vote. So we are doing a lot of lobbying and advocacy in that frame. Our portfolio, priority portfolio area called Healthier Integration is directed by our colleague Anna Rossetti, who you see next to me there. This is really how the health systems are integrating the physical, mental, and social determinants of health. As I mentioned, health is more than just health care. It really is this holistic and comprehensive approach. And Anna's activities in this space include supporting the collaborative network. Remember that goal number one, especially a coalition called the Cover Arizona Coalition that is working to ensure Arizonans can navigate and access the Affordable Care Act here in Arizona through Access or Kids Care or the insurance marketplace. She also supports and strengthens community partners, goal number two, that are working in that space, especially community health centers, and on other issues that are top health disparities in Arizona, like maternal and children's health, especially on tribal lands and in Black and Brown communities. And Anna also takes our lead to inform decision makers, goal number three, comprehensively for Vitalyst, but specifically around healthcare issues. As I mentioned, a big piece of this is protecting Medicaid here in Arizona, which is through Access and Kids Care. A lot of advocacy on that front lately. Our third priority is housing that my colleague Gabriel Jaramillo oversees. That's the gentleman next to Anna there. His work is supporting and recognizing housing affordability throughout the state, especially the collaborative network, goal number one, the Arizona Housing Coalition, which does a lot of advocacy and support to address our housing crisis throughout the state. At the same time, he strengthens community partners, goal number two in housing, including sharing promising practices for especially affordable workforce housing. This is seen in a lot of awesome ways throughout the state where what we call anchor institutions like schools, colleges, community health centers, churches leverage their own existing properties to meet a community need for housing, especially again, affordable workforce housing. And we match them and provide toolkits with for nonprofit affordable housing developers that can build on those properties to meet the needs of that community and be in a multi-use space. A really awesome project with examples across the state. Gabe also does a lot of informing decision makers, goal number three in the housing space, especially to secure more funding for the Housing Trust Fund and a lot of zoning and planning efforts at the local level as well. The fourth gentleman on the screen there is our colleague Sergio Paris, who directs our strategic communications. He helps tell the story of Vitalyst and all of our partners. But because of his background and expertise, he also facilitates conversations for Vitalyst connected with partners that are working in the educational system and the food systems, again, because of his strong background in those sectors. That kind of leads us to our grant making program, the one side of our house. As I shared, Vitalyst supports an upstream mechanism that and collaboratives supporting policy, systems, and environmental change. So our grants program is framed as a system change grant program. As I mentioned, systems change work is hard it takes a village and it takes a lot of time and resources. So, from community and partner feedback, we have framed our grants program in total as a 5-year grant potential of nearly $225,000. That 5-year grant potential is broken up into these three grant categories. So the first category or the first tier is our technical assistance grant, which is meant for collaborative capacity building. Hopefully, after you've built up your capacity of the collaborative working towards systems change, you move into the planning phase of that systems change, which is the second tier of our grant category, the Spark grant, a planning grant for those collaboratives that have built their capacity and need space and grace to plan their specific interventions and solutions towards that longer term systems change. And then hopefully from there, be in a better position to apply for our systems change grant, which is the third tier of our grants program. This is more of like the implementation grant, a 3-year grant that helps those collaboratives that have built their capacity, they've done their planning, they just need multi-year funding to help implement their systems change strategies. So in total, again, a 3-year grant potential, or excuse me, a 3-tiered grant, 5-year grant potential of nearly $225,000. You don't have to start at square one or the technical assistance grant for our grants. If your collaborative is built and you have the capacity and are in the planning phase, you would jump to the Spark grant. Or if you've done your collaborative capacity building, you've done your planning, you're in the implementation phase, you can jump directly to the systems change grant. Also to reflect here, this is aside from our programmatic priority areas. So you don't have to be working in healthcare, housing, or civic health to access our or discover our grant partnership opportunities. This is where we have an open door policy. And so long as your efforts are being driven by collaboratives working towards systems change within any of those elements of a healthy community, remember that will visual, then we can explore partnership. That is the mission alignment. So you don't have to be working on those one of those three priorities. You can refer to the wheel to find mission alignment. As I mentioned, we have an open door policy at Vitalyst Health Foundation, and we help facilitate those open door conversations through what we call our discovery intake process. So as you are reviewing this session and see alignment with our mission and see alignment, see yourself within the elements of a healthy community will, and see alignment with one of our grant types, then you would go to vitalysthealth.org, that Partnering with Vitalyst webpage, and complete a discovery intake form. This isn't the application for the grant. It's simply an intake form, an initial form that you submit some basic organizational information about your collaborative and your systems change project. And once you complete it, it should take you no more than 5 or so minutes to complete. And you submit, our team reviews it, sees if there is alignment, and then if there is, you'll receive a prompt to schedule a time to chat with one of the Vitalyst directors that you just saw in the previous slide. Who you talk with depends on what your project area is, where in what element of the healthy community you work in. So for instance, if you're doing efforts in the to impact the housing system, you would talk to our colleague Gabriel, who directs our housing portfolio. He also facilitates conversations with healthy community design, including transportation and issues of that sort. If you are working on a project that is focused on a specific healthcare issue, then you would be connected with our colleague Anna, who directs our healthcare portfolio. If you, again, are doing work in education or food systems, you would connect with Sergio. I'm kind of a catch-all Renaissance man, if you will, and have a more generalist portfolio, so have broader conversations, and of course, with entities that are working in the civic health space. So our discovery process is an open door policy, so you can easily access and have a conversation with a Vitalyst director to discover partnership. So now taking a deeper dive into our specific grant types. This is for the technical assistance grants. Again, a collaborative capacity building grant. What you'll see here is a general description of the grant and what it supports, and then the 5 criteria for that grant. We have the same 5 criteria for all 3 of our grant types. They will slightly change. The description of those specific criteria will slightly change depending on where your collaborative is at in your journey towards systems change. So for the technical assistance grants, it's for those collaboratives at their beginning of their journey. So in this case, the collaborative can simply be a lead entity. It could be one entity, but the goal of this grant would be to form the coalition, identify those collaborative partners that would be instrumental to helping you plan and implement your systems change. You have to be a nonprofit or fiscally sponsored entity serving Arizona. And while you may not have the specific partners already engaged, you at least have to know generally who they might be. And then over the period of the grant, you can build up the collaborative. You also can leverage this grant to identify and address specific technical assistance needs of that collaborative, including perhaps bringing in a facilitator that can help build up the infrastructure, facilitate convenings, and build up the capacity of your collaborative, the trust, the infrastructure, and all of those aspects. The criteria around health outcome is something you'll also see throughout the 3 grants. But again, how specific you are describing your health outcome depends on where you're at in your journey towards systems change. So in this instance, you should know your general community health issue that you're hoping to improve and reflect it within the elements of a healthy community wheel or the wheel. You have to, that collaborative has to be advancing work in a systems change lens. So we won't just support a collaborative for collaborative sake. That collaborative has to be formed to work on a specific systems change project. You don't have to identify the specific solution or interventions towards systems change, but you should know that you want to change a particular system, and that's why you're forming your collaborative. So that's the kind of a broader aspect of the systems change. But as you'll see in the Spark grant and systems change grant, you'll have advanced quite tremendously in this criteria. All of our grants and all of our work hold a health equity lens, and we hold our partners to that as well. So this is where, in this phase, we especially want you to engage those closest to the problem, closest to the solution from the get-go. This is a really important aspect and a way for you to hold equity in your efforts, especially engaging those community members with lived experience. This could also be reflected and connected with the health outcome criteria, where you are beginning to look at really specific data, especially disaggregated data, that really reflects the greatest health disparities for that particular health outcome. So for instance, you might be trying to improve diabetes rates in the state of Arizona. That's really big, but if you hold a health equity lens to that health outcome approach, you might reflect on data that shows diabetes rates is higher on tribal land. So that would be a specific health equity approach in that specific health outcome. You don't have to get that specific at that point yet, but begin to be thinking about that approach. And then the 5th criteria is a budget that is consistent with the proposed scope of work. For the technical assistance grants, this is a grant for up to 1 year and up to $20,000. We say up to because it really does depend on what your specific collaborative capacity building need is. You might have a smaller scope of work, a smaller time frame and activities, so you might need less than a year and less than $20,000. So this is where we often have you work with a strong local consultant if needed to help frame what that scope of work is, and they may include as part of your grant request their support to be compensated, and their scope of work might be smaller than a full year, might be smaller than $20,000, and then whatever additional funding is needed might still be less than $20,000. So it's up to those amounts, again, depending on the specific technical assistance and capacity building you need. So to discover technical assistance grants, and if this is a good fit, again, you would go to our website, vitalysthealth.org, the Partnering with Vitalyst webpage, and complete a discovery intake form. Once we receive that, we'll review it, and if aligned, you'll receive a link through Calendly to schedule a time to chat with a Vitalyst director. This is a 30-minute initial virtual consultation for us to better understand what your collaborative and project is, how you see alignment, in this case with the technical assistance grant. And then from there, and if the director does see alignment, they'll work with you to collaboratively draft a proposal, which is that scope of work. They won't write the grant for you, but once you have a draft, we review it and determine if there is alignment and provide feedback and answer questions if needed to strengthen your proposal before that director then invites you to submit that proposal for a formal review. That's where the formal application process begins. And then once we receive that grant application, that proposal, we have an internal review team and process that reviews these on a rolling basis throughout the fiscal year. That is why there is no grant deadline or grant cycle for our technical assistance grants. We review these on a rolling basis throughout the fiscal year, again, through that discovery intake process. And as directors see alignment and invite you to apply, then we set up an internal review process, which takes anywhere between 2 to 3 weeks. So there is quite a quick turnaround. The only couple of kind of deadline considerations is this our fiscal year runs July 1 to June 30th. So we review technical assistance grant opportunities this fiscal year through June 30th. And as we go further into the fiscal year, we have a diminishing pot of funds specifically for technical assistance grants. Don't be concerned with that because we have a good amount of funding still remaining for this fiscal year. So don't feel you have to get in immediately. We really want you to be thoughtful. And we will continue doing technical assistance grants next fiscal year. So we could always roll you over for next year consideration. The next tier are our Spark grants. This again is a planning grant meant for those collaboratives that have built up their capacity. Now they're ready to plan towards their systems change efforts. So you'll see the same 5 grant criteria, but here it advances a bit further onto the systems change continuum. So in this case, for the collaborative criteria, you have to have already been in coalition and collaborative with at least 2 partners. We say probably at least 3 partners. And a big question we always get is how many partners should we be bringing as part of our collaborative? And we always say it's quality over quantity. We want you to just have the right partners around the table, including those with lived experiences, who can help you drive the systems change efforts. So when you're thinking about, okay, who should I have around my table in my collaborative? Who are those community partners that will help influence or drive your specific systems change? And with that, think about, okay, who is holding the systems change problem in the first place, and how might those capacity or community partners be able to have sway or influence over that systems driver? The health outcome again focus on a community health issue and framed with the wheel a little bit more specificity with the specific health outcome that you're trying to achieve. And of course, holding a systems change level. At this point, you should again move a little bit further on our continuum towards systems change. Really not just know what system you're working in, but really begin to think about what are those interventions and solutions that you need to implement that will change that system. So a bit more specificity with systems change. And then in the health equity piece, again, still continuing to engage community members with lived experience as part of your collaborative in every step of the way. And at this point, being a bit more specific with that data and that connection to health outcomes. So you're really focusing your work on the greatest health disparities in that health outcome that you're working to impact. And then for this, the budget criteria is still consistent with the proposed scope of work. Our Spark grants are a full 1-year grant for $25,000. Just like for technical assistance grants, we review these through our discovery process. So as you see alignment with the Spark grant, just complete that discovery intake form at vitalysthealth.org and our partnering with Vitalyst webpage. You'll complete that. We'll review it, and if aligned, you'll be prompted to schedule a 30-minute virtual consultation with a director. They'll determine if there is alignment, and if there is, again, work with you to review a draft proposal and maybe provide feedback and questions on that. And once they feel it's in a strong enough position, we'll invite you to submit that proposal as our formal grant application. Again, that kickstarts this particular application process. With this Spark grant, we review these opportunities throughout the fiscal year, but we do have grant deadlines for this grant because we have to get these approved by the Vitalyst Board of Trustees. So in this instance, we have a fall grant cycle and a spring grant cycle. Obviously, the fall deadline has passed, and the upcoming spring deadline is May 7th. Even though it already feels like summer, it's a spring deadline we have. So if you are interested in exploring alignment and partnership for the Spark grant, you would complete the discovery intake form, and then throughout this time frame, a Vitalyst director can determine if you would fit within this grant cycle for this fiscal year. Just like the technical assistance grants, we'll have the Spark grant for next fiscal year. So if your efforts can't get within this current deadline of May 7th, we can just roll you over and consider you for our fall grant cycle. Next year, we will likely still have these two grant cycles, one in the fall, one in the spring. Okay. And then last but not least is our third tier of our grants program. These is the systems change grant meant for, again, those collaboratives that have built their capacity, they've done their planning, now they're ready to implement their systems change grant interventions. The same 5 criteria, but you'll see a lot more detail in each of these criteria because at this point, your systems change project should be completely planned out. You know exactly the activities, the solutions, and interventions you're hoping to implement. So in the systems change criteria, you're further along in your continuum. Similarly, for the collaborative, this is not the time to be building the capacity of the collaborative. You might need to address some things that come up to continue the cohesiveness of that collaborative. But this grant is really meant for implementation. Sure, so you have the right people at the table. You're continuing to engage those community members with lived experiences. The core partners are those folks that will drive the specific interventions towards your systems change. This is a really key criteria in this grant type, along with the systems change piece, because these are the furthest along that you should be and strengthened. So for our collaborative, as part of the grant application, it includes having your core partners submit letters of commitment to show that they are truly committed to your collaborative. They're not just supporting it willy-nilly, they are active and play a key role. So it's a big criteria aspect for this grant. You still have to be working to improve a specific health outcome. Again, be a bit more clear and targeted with your specific health outcome framed using the elements of a healthy community wheel. And in this instance, we really do look to how specific you're getting and what are those specific populations and communities you're working to improve health outcomes for. That connects again with that health equity lens, and again using as disaggregated data as possible and continuing to involve those impacted communities with your systems change effort. In this instance, the budget criteria is also really specific. We have for our grant type, this grant type, as well as Smart grant type, an actual budget spreadsheet for you to complete and put in different expenses for year 1, year 2, and year 3, because as you'll see, this is a 3-year grant. In your proposal, very similar for technical assistance grants and the Spark grant, your draft proposal will include a draft narrative, but you will also upload that budget spreadsheet. For our system change grant, we again can review this opportunity and see if there's alignment throughout our fiscal year through our discovery intake form at vitalysthealth.org, that partnering with Vitalyst web page. You can complete that discovery form and again be connected with a director to have a deeper conversation to see if your efforts do align with the specific grant type. We highly, highly, highly recommend this, especially if you're not quite sure if your collaborative is strong enough or if your efforts are actually framed as a systems change effort rather than a more programmatic or direct service approach. So we highly encourage you to go through the discovery intake form. However, this is also an open application process. So once we open up our grant cycle in the fall, because as you see, this is an annual grant cycle that begins in the fall, you can simply submit an application without going through the discovery process. But again, we highly encourage you to have that discovery call to see if there is indeed alignment so that you really aren't wasting your time or precious, perhaps grant writing resources in a grant that is probably not aligned. So we highly encourage the for you to go through the discovery process. But again, you can submit directly once that cycle opens in the fall. In this case, the proposal is 5 pages where you reflect on the five grant criteria, including a budget narrative, but there will also be a separate budget spreadsheet that you update. Once we receive that, after the deadline closes, we go into our staff and board review. This grant also has to be approved by our board. So we engage a grants committee of our board to help us do reviews. Once we go through that review process, we invite semifinalists to present to our grant committee, which includes, again, some of our trustees and staff members. That presentation is usually scheduled over a 2-week period, but only about 30 minutes virtually for your collaborative, your core partners to come together and present your proposal and address any questions or clarifications needed from our review of your written application. And then once we finish all the presentations, we take our reviews from the written application and the presentations, combine and analyze the data, and make a recommendation for our board to review and take action on. As I mentioned, this is an annual grant cycle that opens in the fall. We're just about to close out our current system change grant cycle with the board approval in the next week. So you'll hear by the end of this month or early April who our new class of system change grant partners are. For reference, we open up the grant cycle usually August, September. We usually have about a 6 to 8 week application period, have a deadline usually in October, and then go through our review process and then make a decision in around March and award the first year grant soon thereafter. To hit really quickly and clarify the systems change piece, and this is a new aspect of our monthly session. Once we kick off our systems change grant cycle next fall, we'll have an information session specifically about the systems change grant where I go much more in depth on what exactly systems change is. If you want to watch this past year's information session, it's all posted to the website, vitalysthealth.org, and on our YouTube channel as well. But just to give you a frame of mind, this is a visual that we use to help folks determine and see if their effort is actually framed as a systems change and not just a downstream programmatic or direct service intervention. So this is a visual that is from a national system change partner called FSG. It's reflecting the 6 conditions of systems change. In your systems change grant effort, or even your technical assistance grant or Spark grant effort, you do not have to tackle all 6 of these. We are just framing it, if you are truly making transformative systems change, which again takes a long time, that change effort does reflect each of these 6 conditions. However, with our 5-year grant potential, your effort might simply be focused on 1 or 2 of these conditions. We often see these conditions and efforts that we support framed as policy or practice changes, because those are the most easiest or explicit to see structural change. For instance, efforts might work to pass a bill at the state legislature that would improve a health outcome. That is a tangible thing you see, right? Like pass House Bill 1 or whatever. But as you move deeper into this inverted pyramid, you see things are a little bit more difficult to frame or define. And this is why we really encourage partners to have that discovery consultation call with us. Because if your efforts are framed as relationship and connection condition, or wanting to change a condition of power dynamics, or the most transformative but most difficult condition to see, mental models, changing hearts and minds, we really need to have a conversation to see if you're framing it in a way that will strengthen your criteria for systems change. So definitely have those discussions through the discovery intake form, intake process. Also, if you want to again get a jump start on really seeing if your effort falls within systems change, go to our website and we have a whole systems change resource webpage where we actually have a Spark report or a white paper that better describes these 6 conditions. We have posted webinars, podcasts, different resources, and different literature that can help you better define what exactly is system change and hopefully help you understand what system change is to see if there is alignment with our grant types. So that brings us to a close here. I will go ahead and stop share so we could be in community. Wow, look at that chat room. Awesome. So Michelle, I'll toss it over to you to highlight any specific questions that came out there and ensure that it's in the recording as well.
Yeah, so the first question is what is the allowable overlap between Spark if approved and systems change? In other words, should Spark be funded in spring 2026? Could we still aim for systems change in fall of 2026 based on the success of Spark planning phase?
Yeah, great question. We really do you could only have one grant at a time for your specific project. So we will work with you to close out your whatever grant you're in, if it's technical assistance or Spark grant, before you can advance for consideration for the next tier. You do have to apply for the next tier. It's not automatic, though we have set up this scaffolded grants program so that we deepen the relationship because we really do want you to be successful, but there still is an application process for each of our grant types. As you go through your grant period, whether it's for the technical assistance or Spark grant, we will set up evaluation check-ins, the reporting that's needed for grants. So our reporting is very light touch. We do a midpoint and then a final check-in. At that final check-in, we'll check the progress. Did you do what you said you were going to do with that technical assistance grant or the Spark grant? And if you did and you're ready to move on, then yeah, we would tee you up to the next grant cycle. And that timing doesn't have to be like we have the Spark grant in the spring and then you apply for this system change in the fall. The Spark grant is basically a year. So it would basically be spring, for instance, spring 2026, and then into spring 2027. And then perhaps you're in a better position to apply for the fall 2027 systems change grant. If you have completed your planning sooner than that, then yeah, we are happy to close out your report and then explore if you are ready to advance to the next level. But we really do want you to take that time that's needed and really ensure that for the technical assistance grants, you've built up your capacity for your collaborative, or for the Spark grant, you've really done the adequate planning to be able to then fully implement your systems change.
Thanks, David.
Mhm.
Next question is what will the fall deadline be for Spark Grant? And if not yet established, what is the general time frame? And I said it's generally around late September, early October.
Yep. We have not set the timeline for next fiscal year, but it'll generally be around September and October. We are working to finalize all the materials, including that timeline, before near the end of this spring.
And then next question.
Oh, sorry.
Yep.
With that, Our discovery process is open though. So if you're aligned with like the systems change grant, which is obviously the current cycle is closed, we can still have those discovery calls with you now. You would just begin to work on your proposal and then submit it in the fall. Similarly, if your discovery consultation is after our May 7th Spark deadline, we will still have a conversation if you're aligned with the Spark grant, and then we would just queue you up for submission in the fall.
Great. Okay, so the next question, these are available across all counties within the state.
Correct. While Vitalyst is based in Phoenix, we have partnerships throughout the great state of Arizona. And we've been really intentional with building and deepening relationships in rural, tribal, and borderland communities because we know those populations and communities have the greatest disparities in health. But if you're doing work in hyperlocal areas of Phoenix or Tucson or Flagstaff or wherever, that's okay too. But we can partner with any entity that is serving the state of Arizona. This includes partnering with national organizations or organizations that are outside of Arizona, but their work is serving Arizonans. If that is the case, obviously we really want local partners to be part of that collaborative. It can't just be, a national organization parachuting in. Local partners should really be engaged in driving the work, though in many instances, the national entity might be the lead applicant. And one instance where we're working to deepen and partner relationships is I'm in Tucson today visiting with partners down here. So I see my friend Kent. So Kent, I'll have to hit you up the next time.
And one clarification is we do have the medical assistant grants open currently with a deadline of April 17th, I believe. That is specific to Maricopa County since those are donor advised funds.
Yes.
Okay, so I had a question from the registration that I wanted to bring up because it was a great one. Is this the best resource for startup organizations needing initial assistance?
Great question. Um, if We don't have a threshold on a budget size of an entity, or you have to have a budget for 3 years or whatever it is. Um, we work with a lot of grassroots community-based organizations that are in startup phase. We would really just ensure that that lead applicant has the capacity to be the lead applicant and oftentimes the backbone of the collaborative. So, additionally to that point, um, the readiness or the kind of of that entity should really be two-pronged. One, does that lead entity have the capacity to take on a collaborative effort? And it's more so if the collaborative has the capacity as well. So that's where we begin to assess in that collaborative criteria. Because if your collaborative is in startup phase, that would be the technical assistance grants, and that would be the perfect place to start. So long story short, yeah, if you're in a startup collaborative phase or a startup entity that is working to build up your collaborative, definitely reach out, have that discovery consultation. And if you're aligned with the technical assistance grants or even perhaps a Spark or system change grant, we can have that discussion.
Perfect. That's all the questions I have. So if anyone else has questions, you can put it in the chat or come off mute.
I guess I have a couple of questions if I may.
Yeah, go for it, Carlos.
So the you presented a lot of elements, wonderful elements. I totally get it. It's a very organized process, so thank you for that. And yet, I'm wondering if we submit information through your form, your online form in the discovery process phase, do you want us to clearly identify what our goals are? Our thoughts align with those elements, or does it have to be that specific, or can we just describe sort of the general thinking about what we're thinking about, what may be some of the problems, what may be some of the issues, and then taking it from there?
For sure.
Sense.
And I'm trying to pull up the discovery form really quickly. And of course, I'm having difficulty. But the discovery intake form is a really simple form that, again, should take you no more than 5 to 10 minutes to answer. So we collect basic organizational information, and then the questions in the discovery form is, what is the system and the problem you are trying to solve within that system? What is the goal of your system change concept? Which of the 6 conditions of systems change is your project trying to address? Remember the pyramid. Um, if you have identified organizations involved in this collaboration, list them below. What health outcomes are you hoping to achieve? And how do those health outcomes connect to the elements of a healthy community? So it's very connected to the grant criteria, but it's very high level. I don't even know, Michelle, if there's a character count limit on that, but it's just really high level. The more specificity is in the actual proposal or application, but don't feel like you have to write your whole grant application in the discovery form. It's just initial information so that our directors can know just enough for that initial consultation. And then that consultation, then you could begin to get down more into the weeds and how your effort might fit within those 5 criteria. And then from there, they might have enough for you to then begin working on a formal draft for them to review.
Great. So some alignment with those elements, but still high level. And let me
Yep.
ask my second question, which is very much connected to the first one, which is, well, how about if we serve a very specific, unique community, but it's been decades since this sort of analysis of what the needs are around this specific community are. And so, as one of the providers in the space, we kind of have an idea of the challenges of some of our clients and but there's so many other players that we want to tease out what those challenges are in the system by getting them together so that we can hear from them their perspective and then develop a more targeted description of what the challenge is, what the systems are. Are we would to me it sounds like it's a step even before one of the first things you're funding.
Yeah.
About that.
Yeah, that's a really good question. And there have been aspects where we have funded oftentimes in the technical assistance grant phase, or sometimes even the Spark grant phase, more like data collection and community engagement to help that collaborative better understand what are the exact and specific health outcomes that we should be working on, and what especially with that community engagement and feedback, the interventions and solutions that would work. So it would be helpful to probably come at this with updated data, because if we're reviewing your grant proposal and we see that you're using like 10-year-old, maybe even 5-year-old data, a lot's changed in 5 and 10 years, right? But you might think, okay, we are probably at that beginning phase of that data collection and better understanding community needs. So let's start at the technical assistance grant and then move along the grant continuum.
Okay, so your challenge, your specific challenge and system you're trying to change, it doesn't have to be completely spelled out, not even in the technical assistance phase is where I'm, or should
Not,
be.
yeah, not, you don't have to know your specific intervention or solutions. You could build the capacity and begin to plan and think through what those strategies are in the technical assistance and the Spark grant phases. You should at least know what system you're hoping to change, and that you want to take a systems change approach, not just offer, again, programmatic or direct service approaches.
Got it. Okay. Thank you so much. Appreciate it.
Yeah, thanks, Carlos. I see Brennan and then Andrews.
Yes, hi. Appreciate you guys' time today. Exactly, just echoing what the Carlos was saying, is you guys seem very organized, and I appreciate all the in-depth insight. Um, my question is correlated to, if in the event that we, find ourselves aligned to one, if not all of the grants that you guys have optionality towards, and we do the discoveries for each one at the respective stages. Let's just say we start out with the technical grant. Is there more means of being able to build a collaboration between the two organizations, yourself and say ours? Once we go through that discovery, you see there's alignment. Is it more than just access to funding? And could you guys, because you guys are such an critical grass rooted in the state of Arizona, you guys have a lot of relations and a lot of network. Is there a means to be able to have that collaboration open up to be able to find other pathways and other avenues for being able to find the funding for our respective organizations attempt to do that system change?
Yeah, Brennan, thanks for that question. Absolutely. So we practice in the sector is called trust-based philanthropy. There are a lot of key principles to that concept. One includes providing as multi-year general operating support as possible, and we've tried to do that with our 5-year grant potential. And as you'll see in our budget spreadsheets, it's really general and we don't have like specific thresholds or restrictions so long as those costs are associated with advancing the systems change. And as your another one of those principles is providing that funding and having that reporting as flexible as possible, but going beyond the check. So once we onboard, once we go through the whole review process and you receive the yes for funding, then we actually onboard each of our partners and implement what we call a stewardship plan. So our colleague Erica Foster, she manages our stewardship plan and all of our partner engagement. She also does our evaluation reporting with our partners, though again, it's really light touch for us. And we have generally quarterly learning sessions for all of our partners to help them deepen their collaborative capacity building needs and their understanding and approaches to systems change. So that's one way that we provide additional technical assistance. This is especially seen in the systems change grant budget spreadsheet, but probably, Michelle, we should have this reflected in the technical assistance grant and the Spark grant template as well. There's columns for how you want to leverage the systems change grant. But then there is a column for you to think through what is the big anticipated cost of your total system change grant project, because it will for sure probably take more than $175,000, which is the system change grant, right? So we want you to be thinking big picture. And I know it's really hard to think through all the specific budget line items, but it really is just anticipating what that overall cost is. So then we could look at that gap, right? And as we finalize our recommendations to our board, we have deep relationships with a lot of other local funders whose efforts might align with yours. So we oftentimes make warm introductions to our partners with other funders to try to fill that gap with you. And just try to make other connections to community partners that we think might be well aligned. This is where that discovery consultation call comes into place because we can't sort of identify like your core partners singularly. We can provide some advice and even warm introductions as we have them. But if you need just to identify those core partners, we have leveraged a technical assistance grants for the lead applicant to do just that, like bring in a facilitator who knows a specific space, for instance, a health sector, and then identify who are those core partners that should be part of them, and then begin to facilitate convening conversations. So we're happy to go beyond the check. We have a whole plan set up to do that. And then even before then, before our formal grant partnership, provide as much support and technical assistance as needed. And again, that's why the discovery call is so important because one, we do want you to identify early on if there's alignment or not. We really don't want you to waste your time and your precious resources if there just isn't alignment. And sometimes there's not, and that's okay. Especially around that systems change criteria, because if you're doing a very important programmatic or direct service work, it's just not aligned with Vitalyst grant programs. And then making other connections to warm partners that we have. We have, even beyond the 4 directors that you saw on screen, we have a whole team of super engaged, knowledgeable folks that we would gladly connect you with if it is valuable to your collaborative and to advance systems change. Thank you, Brennan. I know it's the top of the hour. Andrews, you had one question. If you have to drop off, no problem. We're going to continue to record. And then again, we'll share this recording and all the materials in an email to all those who registered and post it also to our website, vitalysthealth.org. So if you have to drop off, no worries. Thank you so much for joining us. But I will turn it over to Andrews if he's still on to ask their question.
Yeah, what's going on? Hello.
Hello, yes, ready for your
Hey,
question.
yeah. My question is, um, so, based on what you have shared here,
Mhm.
um, would recovery housing, work in Mesa be a good fit for the discovery process and technical grant?
It depends on if your efforts are, again, fit within those five criteria. So if it's just your one organization
Mm-hmm.
providing a direct service, probably misaligned. Or if you're but if your one organization is hoping to build up a collaborative to address your specific health issue in a system change framework, then yeah, we definitely would be aligned. Again, I would need to know more about your project and encourage you to complete a discovery intake form so that we could review it and then determine if there is alignment or not.
Okay. Okay. Um, so as far as the application now, what do you think would make an application stand out at the discovery stage for an organization like mine?
Yeah, the discovery form again is really simple. You provide high-level information, answering those questions that are reviewed earlier that are generally reflected by our criteria. But the big things that we're reviewing for the discovery intake form is if your effort is actually systems change,
Hmm.
that lens. So that will be really important for you to clarify that your effort is tackling your issue in a system change lens. Again, if you're at the
Hmm.
beginning of your work, you don't have to know the specific activities towards system change, but at least know what system you're hoping to change and that your collaborative effort is leading to that change. So the discovery form, again, we don't have an evaluation rubric or whatnot. We really just do an initial scan and say, yeah, this is a system change approach. Or actually, it's very programmatic. And if there's iffy, then we usually advance you and have you connect with a Vitalyst director to learn more.
Okay. Okay. Thank you.
Yeah, thanks for your questions.
Hmm.
Any other final live question before we sign off? Awesome. Well, thank you all for joining us and for staying a little longer. If you do have any other questions, don't hesitate to reach out to us. Again, this recording, the materials and the slide deck will be shared via email and posted to vitalysthealth.org. If you do see alignment, please go to that website and complete a discovery intake form, which will begin the process for us to have a time to chat more in depth. Thank you again. I hope everyone stays safe and healthy. Please stay cool as much as you can and hydrated. Thank you so much.